Welcome everyone to this session about electronic prescribing. My name is Margaret Dempsey and I'm a registered nurse and I work with APNA. I'd like to begin our session by acknowledging the traditional owners of the land on whose country we're meeting today. APNA recognises the traditional custodians of land and sea on whose lands we work and live. I wish to pay my respects to all traditional owners and elders, past, present and future, and to any Aboriginal and Torres Strait Islander people that are joining us today. I'm coming to you from Wadawurrung country in Victoria. So I'd like to introduce today's presenters. We've got Max Blobergs, who's an educator with the Australian Digital Health Agency. So hi, Max. And we've got Sian Pritchard, who's a mental health nurse practitioner and the director of Pritchard Health, which is a nurse-led clinic located in Geelong in Victoria. Welcome to you, Sian.
Hi, everyone.
During this session, Max is going to explain the key elements of electronic prescribing, and Sian will then provide the perspective of a prescribing clinician utilising a case study format. And then we'll discuss the benefits of electronic prescribing that can have to patients and the role that nurses play in this. So you'll have an opportunity to ask questions towards the end of the session just by typing into the Q&A section at the bottom of your screen. So we hope you enjoy this session. Over to you now, Max.
Thanks, Mark. To start off today, we're going to provide you, I'm just going to go through a bit of an agenda for us today. So we're going to go over an overview of electronic prescribing, including the core features and benefits of electronic prescribing. We're going to go over electronic prescribing tokens and how they work, how they function. We're going to discuss management options for electronic prescribing and look into active script lists. We're also going to explore a case study on electronic prescribing, as well as go through some questions and answers with you. So first off, what are electronic prescriptions? So electronic prescriptions are computer-based electronic generation, transmission, and filling of a medical prescription. So this is taking place of paper and fax prescriptions. Electronic prescriptions allow a medical or nurse practitioner to use digital prescription software to electronically submit a new prescription or renew an authorization of the script to a patient or pharmacy. An electronic prescription is a digital version of a paper prescription, and during a consultation, your healthcare provider can send your electronic prescription to you as an SMS or an email. So as I mentioned, electronic prescriptions are an alternative to paper prescriptions. Previously, only paper prescriptions signed by a prescriber have been a legal form for the supply of medication, but changes to the Commonwealth legislation from October 2019 recognise the electronic prescription as an alternative legal form by which medication can be supplied under the Pharmaceutical Benefit Scheme. Electronic prescriptions are not mandatory, and there's still the option to choose paper when it is required. So let's have a look at some statistics here. So these are some stats from February this year. And as we can see in the top left here, we have close to 40 million electronic prescriptions that have been generated. And in terms of prescribers that have generated an electronic prescription, we have over 35,000 prescribers. So that includes GPs as well as nurse practitioners. And if we look at the graph at the bottom here, we can see the number of electronic prescriptions has increased quite substantially from last year. So if we look at April last year, we can see that it was close to 10 million, and it's gone all the way up to close to 40 million just this year. So it's really increased a lot, and electronic prescriptions are being used more and more. So let's have a look at the evolution of prescriptions. So prescriptions have progressed from your handwritten paper scripts. You may all remember the handwritten paper scripts on the left-hand side, which can still be used today. Then we have the printed scripts as well, which is the second one along here. Then we progress to an electronic transfer of a prescription script, where you can actually see the barcode at the bottom, and this barcode would then be scanned. And now we've progressed to electronic prescriptions where there's no printed prescription. Instead, the patient is sent a token. So when the prescriber issues an electronic prescription, they'll provide the patient with a token that contains a unique QR code. And this is for each medication. And this will be sent to the patient's mobile device. Patients can choose to receive the token via SMS or an email, and they have the option of managing multiple tokens using an app. The token is the evidence of a prescription. However, it's not a legal document, but it is the key that the pharmacy uses to access a prescription delivery service, which then stores the legal electronic prescription information. So these are some examples of screenshots that you would see of a patient from the SMS view. So in the first image here, you'll see the token appears as a regular text. And then once you open the message, you'll see the second image here where you'll see the link. And once you click on that link, you'll then see the token QR code. So this third and fourth image, they're both images of tokens that would be visible on the phone. And these are images from ERX, and we also have one from MediSecure there as well. Both of these are prescription delivery services that store the legal contents of an electronic prescription until the token is scanned by the pharmacy. And the token will have some information on it, such as the drug name. It's going to have the quantity, the number of repeats. And so the patient knows which medication the token relates to, but you'll also notice that it doesn't have the patient's full name. It just has their initials, and it doesn't have the doctor's details or the instructions for the medication. But once it's scanned by the pharmacy, it's then enabled through their software to show the pharmacy the full information that's required for that prescription. So looking at some management options here. So a patient can either receive an SMS or an email. The patient can also choose how they receive the token, if they want it sent to them directly. Otherwise, they can have it sent to the pharmacy, or even a carer can receive it on their behalf. They can use a mobile app to store the tokens, or they can register for what's called an active script list in pharmacies that are set up for the active script lists. So what is the active script list? So what it is really, it's a token management solution. So the patient may want their electronic prescriptions in a consolidated list so that they can be more easily managed, especially for patients who have multiple medications. The active script list is a list of all the active prescriptions and repeats that are available to be dispensed. And so an active script list removes the need for the patient to receive their tokens via SMS or email and retain their tokens. So how do patients use active script lists? So to set this up, a patient will be attending their preferred pharmacy, and prior to attending, the doctor or the nurse practitioner and request to be registered for an active script list. The patient then needs to accept the terms and conditions, agree that all prescriptions will go to their active script list unless they withdraw their consent. And then the patient then attends their healthcare provider and receives a prescription. If the patient chooses, an electronic prescription is provided, and it is also automatically added to their active script list, unless they ask their doctor not to do that. If the patient does not need a token, they can receive one or they can receive one if they really want to. So the patient then presents to their preferred pharmacy where they validate their identity and then they receive their medication. And if there's repeats, they can then be added to the active script list depending on what the patient chooses. So to set up for electronic prescribing, you'll need to follow these steps as well as have access to electronic prescribing software. So you'll need to ensure your organization has a healthcare provider organization number, or a HPIO. And we do have information about this on the Digital Health Agency website as well. So if you need further information, you can always check our website. You'll need to confirm that your organization has downloaded and installed a NASH PKI certificate. So that is the National Authentication Service for Health Public Key Infrastructure Certificate, which allows for access to digital health services. You also need to ensure that your organization and individual prescribers are connected to a prescription delivery service, such as I mentioned before, ERX or MediSecure. Those are examples of prescription delivery services. And the software may need to be upgraded to the latest version and relevant identifiers, such as your HPIO, HPII, or IHIs recorded within the system. So you don't need to remember all these steps. You can always check the Australian Digital Health Agency website for resources, including there's also the electronic prescription toolkit that you'll be able to find there. We have electronic prescription information updates, as well as EP training. So definitely a great resource just to check through the Australian Digital Health Agency website. Okay, now I'll hand it back to you, Mark.
Thanks, Max. Thanks for explaining electronic prescribing in such detail, and what great slides. I just thought that was so easy to follow through. And early on, when you mentioned that from October 2019, that changes were made to legislation to actually make electronic prescriptions a legal format. And I thought, October 2019, well, didn't that come in just in good timing, given that we were knocking on the doors of a pandemic? And now, and the value that electronic prescribing has provided during this time, and then showing the QR codes, where previously QR codes, people wouldn't understand what that was, or not familiar with it at all, and just how things have moved along, and we have a much greater understanding. So thanks very much for those great slides and explanation. I'd now like to hand over to Sian Pritchard, who's going to explain electronic prescribing from a clinical viewpoint. So welcome, Sian.
Thanks, Mark. Hopefully everybody can hear me. And it's great to see so many of you have turned up today. I would like to give my personal thanks actually to all the nurses and midwives out there. We've had a pretty tough 2 years. I hope you're all looking after yourselves. So on to my case study. So today I brought Barbara, who's a 36-year-old lady. She lives about 30 minutes away from the clinic, which doesn't seem that far, but she does have 3 children between the ages of 4 and 14. She also works in an aged care facility, actually. So I've been prescribing Barbara buprenorphine for probably 2.5 years now, maybe 3 years, and she's been very stable for over 5 years, and she was taking this before she came into my care. So during COVID, she was homeschooling 1 primary school child, 1 high school child, plus, of course, her 4-year-old with a 2-year-old at home. So a very busy mum. At varying times through, I've said through COVID, but through the pandemic in the last couple of years, she's requested to have telehealth video consults. And I provide video and telephone consults from my practice. She'd requested these because, although only 30 minutes away, trying to manage through a pandemic and with these 3 young children at home, it seemed much more convenient to her. So when electronic prescribing came in, it also made my job much easier. A little bit about how I prescribe. My software is set up now, such as I can prescribe straight out of my medical software. I do ask, well, I actually, when I'm talking to my patients, I ask them if they can just excuse me for a moment and I won't talk to them and let them carry on doing what they're doing so that I can concentrate on what I'm writing in the script. Some of my scripts that I write are a little more complex. So I like to have my focus on my medical software whilst I'm doing that. So in asking her where she would like the script to be sent, I can confirm with her if she wants that sent to her telephone or directly to the pharmacy, which again has been very convenient through the COVID pandemic, where people have been trying to limit how much they've been going out of the house. Once I've got my script correct, I double check, okay, so if you want this sent to your phone, I want to confirm the phone number with her. And it's not that easy, I suppose, to explain without you seeing the medical software, but it's a really easy process because if you're doing a script, you get to the end of writing the script and it either says print and save or print and send. So when I click send, that means that another screen flashes up and I can choose where we send that script to. So I ensure that I've got the correct phone number in or the email in that Barbara's wanting that script to go to, and then I click send. And then before I finish my consult with my patients, I do ask them to confirm that that script's come through to them. And it's pretty instantaneous. Actually, I can often hear their phone making a buzzing noise with that message coming through to them. Since actually the beginning of the pandemic, Barbara's changed over to injectable buprenorphine, which again is very convenient for patients. They only need to have an injection once a month instead of going to the pharmacy, a number of times a week, and it's also a lot more cost effective for them. Because of this now, Barbara obviously has to come into clinic for her injections once a month, but she still opts to have an electronic script. And what we do there is I do the electronic script when she's in the room with me. But she's opted to have that script sent directly to the pharmacy that stores the injectable buprenorphine for me. So that can go electronically straight through to the pharmacy. It saves Barbara having to drive into the city to another pharmacy to pay. So she just pays on the telephone. So it's worked out really very conveniently, whether I'm doing telehealth or in the room with patients. I was asked to put together some reflections on my thoughts. So I guess it's, 18 months since I've been doing electronic prescribing. And it was an absolute godsend to me because when COVID hit, it was a matter of trying to manage telehealth appointments with patients, having to, and not lucky enough to have, I guess, support in the clinic. And so if I need to, print scripts, fax scripts, post scripts, that all falls down to me. So it took up extra time and extra expense, of course, having to send scripts out to the patients or if they want them to go directly to the pharmacies. So when electronic prescribing came through, it really very, very helpful. And it just fits in with a lot of the other software that I use, like My Health Record, which is another really good way of, working with patients and ensure that they have really good, I guess, continuity and collaborative care going on. My initial software setup was quite complicated for me, but I did have lots of issues initially. My specialty is in nursing, not in IT. And so when I didn't have IT support, it was quite complex. And there again, I think anything that nurse practitioners do just seems to be more complex than when other health professionals have to do system setup. But again, once it's been set up, it's just wonderful. When I initially set it up, not all pharmacies were on board. And so I would ask patients to call their local pharmacy to just ensure that they were set up for electronic prescribing, that they had the software in place. So initially there were less pharmacies, but I would say seems to be most pharmacies are on board now. So that doesn't seem to have been an issue probably now for the last 12 months, maybe. What else? Oh, I think I wrote actually something about, because I do prescribe drugs of addiction, in Victoria, we have a system called SafeScript that we have to link to as well. And so again, you know, the electronic prescribing just fits in really nicely with all the other background electronic systems that we use these days. And I think that's about it, actually. But I'd love to have questions from people. Thanks, Mark.
Thanks, Sian. Actually, there is a couple of questions already coming through. And one of them is, are you able to prescribe S8 medications in this way as they need to be handwritten? So could you explain, talk us through that process, please?
Yeah, so we are able to do it through the token systems. That's been acceptable. And yes, we print out S8 medications and then we have to handwrite on them, but you can do the electronic prescribing through there. And as I said, in Victoria, we have you know, we need to check SafeScript before we actually send those scripts. I'm not sure. I think the rest of the country is developing. There's other systems being developed across other states, but in Victoria, it's SafeScript. I'm not sure about the other states.
Thanks for that. So I hope the person asked that question. That's a good response. Thank you. And Sian, can you talk us through then that electronic prescription process that you actually follow at your practice?
Yeah. So again, straight out of my medical software, if I was going to prescribe a medication, I just do the usual. And it really is just at the end of the process that you either save and print, which would be a normal paper script that I would print out for the patient, or save and send. And then as soon as you click save and send, it flashes up another page, which asks you to confirm where you want that token to be sent. And so you just, you know, in the medical software, it's generally, you know, the patient's telephone number will come up because that's already in the system. But I always, as a safety measure, I always read that out to my patient to double check, is this the telephone number you'd like this to be received? Yeah, and it's as simple as that, really. You just then click send and the patient receives the token.
It's always good to double check your processes. And I know that certainly in general practice environments with the use of these digital technologies, reception staff, it's now far more commonplace or perhaps on their radar when patients come in to always check the mobile phone number and an email address to make sure that it is on the system, because they're the things that can change and vary. Sometimes quite often for some people, others keep the same numbers all the time. Thanks, Sian.
Sorry, Mark, I might just say as a safety, I think it's been built in as a safety, but if you do click send and it goes, then you actually can't resend it again. So if you've made a mistake, then you actually then have to print the script out and get it another way. So yeah, so it's always good to get it right the first time with these systems. Otherwise you'll end up taking up more time doing it another way. Yeah.
Absolutely. And a question's come through, and I think it's referring back to the S8 medications question. It says, does a hard copy need to be mailed?
Not that I'm aware of, no.
No. So,
no. And in fact, through COVID, when we were allowed to fax scripts through to pharmacies, we were asked to keep our copies of our scripts on site, locked out.
Okay, thanks very much. I'm just going to bring Max into the conversation now. If yeah, Max can pop his microphone on and ask a question. Can prescribers send the electronic prescription directly to their patient's preferred pharmacy?
Yes, that is a good question, Margaret. So prescribers can send the electronic prescription directly to the patient's preferred pharmacy, and that's as long as it's the patient's preference. So what's really important and really central to the design for electronic prescriptions is to give the patient the choice. So that includes the choice of even receiving a paper or an electronic prescription, or the choice as to which pharmacy it's going to go to. So when a patient has the prescription with them, they can choose to get the medication when they need it. So that's why it's really important that the patient does receive it. But there are options available for patients who are not able to access electronic prescriptions. So that includes sending the token to a carer as well, as I mentioned before, or just receiving a paper prescription. That can also be an option as well. There can be certain situations where prescriptions need to be sent directly to the pharmacy. So that could be situations such as at residential aged care facilities, for a emergency supply or a stage supply. But what it really comes down to is that it's really important that it is the patient's choice as to how and when they get their medication through electronic prescribing.
I think that's what the benefit of this is, that it provides people with a choice. And as you said earlier, paper prescriptions haven't disappeared, so people can still utilise them if that's their choice. But electronic prescriptions give people alternative choice, and that's a good thing. I just also want to make mention, someone has put into the chat box that in Western Australia, they are asked to provide a hard copy of the S8 script. So I'll just sort of take this moment to say Sian works in Victoria, and so of course is obliged to comply with legislation and regulations. And as we know, Australia is an interesting country, and state by state things do change. So you obviously need to make sure that you're working within the scope and under the legislation within your state. So remembering that, yes, Sian.
Sorry, Mark, I interrupted Dan. Yeah, and I'm not sure how that would work actually in Victoria, because if we print a script out after we send an e-script, that makes the e-script null and void, and the because it goes directly through the safe script as well, which is our monitoring of drugs of addiction. So yeah, so obviously there are some differences across the country at the moment.
Yeah, so just be aware of that. And Max, while I've got you there, another question is, are hospitals likely to adopt this system?
Yeah, that is a good question. And really what it comes down to is the software availability. So within practices that use electronic prescribing, they need that. They need to have the correct software and they need to be set up. Hospitals have to have that software within their system. Currently, there isn't as much use by hospitals, but that is certainly something that would be used in the future. But primarily, it is used in primary healthcare, so at general practices primarily at the moment.
Thank you. And Sian or Max, feel free to respond to this next question of, can you save particular emails or mobile phone numbers to pharmacies when you're sending ERX?
Well, I'm happy to answer. So you can actually, you would change it, I suppose, in the patient record. In their medical, in the medical software, you'd have to identify it in there as where that script is needing to go. So there's probably some way of setting that up automatically.
And I know.
But generally, I just type it in when I need to, if they choose for it to go anywhere other than a number that's already in the system. Yeah.
I was going to say, I know for me personally as a consumer who loves electronic scripts and has, I have downloaded the app that my local pharmacy uses. So it's always there. It's connected with my payment details. And so when I need further scripts, I can just get onto the app that's on my phone and request to have it sent, pay for it, and either pick it up myself or they actually do a free delivery service in my area. So the app, having the app download on my phone makes it so much easier. And when I connect with my GP to have a new script, the information is already there. They're not constantly asking me the mobile phone number, it is already there, but they just check, is this the correct one? So thank you for responding to that one. Sian, for nurses who've not had much exposure to electronic prescriptions, can you explain how electronic scripts could be relevant to them in their practice?
Do you mean to nurses who prescribe or to nurses who don't prescribe, or to both?
I think nurses who don't prescribe, how electronic scripts could help them and how they can help their patients.
Yeah. So I guess I see nurses as we're the people that provide lots of information and educate patients, and I guess whether we're going over something that another health professional has gone through with a patient, such as, I guess a GP might have prescribed something by the electronic prescribing, or it may be something that we might want to introduce to patients as this may be actually a convenient way for you to manage your prescriptions, your medication. I'm thinking maybe in the case of, thinking through the pandemic, older population, they didn't want to go out very much because it was a dangerous world for them at the time. And so being able to, if you're talking to people doing chronic disease management plans or that sort of thing, I suppose that could be something you introduce into a conversation, and then we can help, I guess, provide patients feeling confident that their information is still private and confidential and nobody else is going to be able to access their scripts, but also talking them through recognizing, well, this is what it would look like and this is what you would need to do as a follow-up. So that's sort of the thing I'm thinking is, does that make sense, Mark? Yeah,
it does make sense. Thank you very much for that. Somebody's put a comment in to when we spoke about the hospital sector. Someone said that they've actually been looking into this in the hospital, and software is the issue. So you're right on the money there, Max, that obviously in that larger hospital sector, if they're looking to change software, it then becomes a bigger issue. But let's hope that they can move to that to make it a lot easier for the patients, for the clinicians as well. And the comment was made that it's also been an issue during COVID when patient appointments are telehealth. And someone's asking, is there any government initiatives to support public acute health services? So I'm not sure if that's in your remit, Max, or not.
Certainly, there is initiatives to support telehealth, and there is public health services, I believe, through Health Direct. I believe they do have some processes when it comes to telehealth and supporting digital health services that way. But again, also through primary healthcare that is available to the public as well. So through attending general practices, people will be able to access these services. And yeah, as I did mention about hospitals, it can be very state dependent as well. There's a lot of considerations when it comes to making changes to digital health services, and access to software is definitely a big part of that as well. But fingers crossed, that this will all be changing in the future, and there will be more access in the future. But yeah.
And I think remembering just what we said earlier, that this is only from October 2019 that electronic prescriptions, the legislation has changed, that this is now a legal format. So we are still in its infancy, and haven't we jumped into the deep end with a pandemic as well? But as you say, Max, it's a bit of watch this space, because things will now be moving and progressing in that direction. I would understand as well. So somebody's asked, if a patient finds themselves away, so travelling away without their medication, can the preferred pharmacist email the script to another pharmacy? Or what would be the process if someone was who utilised electronic scripts with their pharmacy, but then were travelling away and actually needed to access scripts? Who wants to take that one?
I'm not sure if I can answer this. The script is actually on the patient's phone. The scanner code is on the phone, so I would have thought that they would be able to take that to another pharmacy to scan into their software, maybe.
If it hasn't already been accessed by the
yes, if they
first
haven't already
pharmacy.
filled the script. I guess if they fill the script, it might be that they have to contact their health professional to have a new one sent, maybe. I'm not sure.
Yes, yes, Sian. So if they've been given the script and their pharmacist is away and they need to go to another pharmacy, they would be able to. They do have that option to choose where they go. But as you mentioned, if the script has been filled, then they would need another prescription. It'll be the same with a paper script as well. If the script is filled, they'll need another prescription as well.
Thank you for that. And someone's asked, just clarifying in relation to carers. So when you said before it could be sent to a carer or an agent in their interactions with facilitating ERS, is this in the context of carers in the community and in-home support, as opposed to carers employed in aged care facilities?
So when it comes to aged care facilities, so for example, if there's a resident in an aged care facility, a general practitioner has seen them and they've sent the script to the pharmacy, then it would be delivered directly to the aged care facility and it would be handled as a medication within the facility. So, and then it would be provided to the patients via the nurses that work in the facility that would be giving the medication to the patient. Otherwise, if, for example, if a patient is unable to access their phone or they have difficulty with technology, they do have the option to receive a paper script. So that is still there. It is still available. Otherwise, as I did mention, they also have the option to have it sent to a carer as well. So those options are available to them just to make sure that they can get their medication that they need.
Yeah, and I think, as we've said before, this is all about choice. So it's all about exploring the options and the best options for that patient, and they have choice. So what about repeat scripts? So you get the token with your script on your phone and sent to the pharmacy, but what about repeats? Is there any difference in the process?
As far as I'm aware, those repeats are still available on the telephone.
Yes. Yeah, so the repeats, the repeat is actually stored within the prescription delivery software. So when they go to the pharmacy, for example, if they have 5 repeats, they've gone and gotten their medication once, so then they have 4 repeats left. So they just go back to the pharmacy and show their prescription, and then they'll be able to see within the prescription software how many repeats are left, and they'll be able to give the patient the medication.
And so, Max, does the person then have to go back to that same pharmacy to dispense the repeat?
As far as I know, it would be within the prescription delivery software, which could be used by many different pharmacies. So they would be able to go to other pharmacies if they do need the repeats.
Thank you for that. Well, we've got a really engaging audience today, asking lots of questions. That's great. So we've just answered that one about the repeat scripts. Someone's made a comment that with electronic prescribing, that an advantage is that there's also reduction of medications wasted. And do you know if is there any overarching body that's actually assessing that, as in reductions of wasted medicines?
I don't know.
Yeah.
I'm not very familiar with it, but I think it's a very good point. When you have the prescription easily accessed, you can just get the medication when you need it, so you don't need to get massive supplies of medication, and potentially they may run out of expiry date. So I think
Yep.
it's a really good point. In terms of who is monitoring that, I couldn't answer,
Right.
but I'm sure it would be monitored, and that would be one of the benefits of using electronic prescriptions.
Yep. Thank you very much. So Max, what's your take-home message for the audience today?
Yeah, so my take-home message would be to say that there's so many benefits to using electronic prescribing. It's been a really important part of the nation's push to enhance the safety and quality of the prescribing process. So electronic prescribing can really increase the efficiency. It can reduce that administrative burden, improve the legibility of the prescriptions, because we've all had prescriptions where we weren't able to read what it was actually for in the past, I'm sure. So having that legibility improvement, it also increases access to medications as well, reduces prescribing and medication errors, and that all really comes down to improving patient outcomes. And also saving on healthcare costs, as one of the audience members even mentioned, reducing that medication wastage as well, which is also a very good point. So my take-home message would be that if you're not already using electronic prescribing, or if your practice isn't using it on a regular basis, I'd encourage you to get started. We have plenty of resources, as I mentioned, on the Australian Digital Health Agency website. So as a starting point, you'll find resources to assist you with setting up for your practice for electronic prescribing, using the electronic prescription toolkit. We also have training materials, modules on electronic prescribing that you can access. So if you want to go to our website, it is quite easy, and I'll actually show you what it looks like. So you just type into your browser digitalhealth.gov.au, and I'll just open that up and show you what it looks like on the screen here. So you just go to digitalhealth.gov.au, and then on our website, you go to for healthcare providers. And there's a lot of resources here. So you can see that there's nursing and midwifery resources. So you can click on that. And you can look through the different resources, including electronic prescribing. There's also training here, online training. So there's a lot of resources there for nurses. And then if we scroll down further, we can also see initiatives and programs. So electronic prescribing, you can find information there. As I mentioned, you'll be able to find that electronic prescription toolkit as well, which helps with setting up for electronic prescribing. And then if we scroll down further, we can see other My Health Record resources, training and support. So here we have online training and courses as well. So this is quite beneficial. If you want to learn about various aspects of My Health Record, you can do some of the courses that are available, these modules. So for example, we have My Health Record in emergency departments, in general practice, My Health Record in nursing, electronic prescribing in your practice. So as you can see, there is a wealth of resources there that's available in the website. And you can also register for events and webinars here as well. So any events that you'd like to attend.
Thanks, Max. It's so good. We know that there's a lot of resources out there, but sometimes trying to find them can be difficult. So that little walkthrough of the agency website was great, where people can look and actually see what the information that they want, or sign up for lots of online training. That's fantastic. Before we end today's session, we're going to launch a poll now, just with 4 questions that I'd really ask the participants to please complete, so that we get to know who's been listening today and whether the information provided has been helpful for you. So we can't see your responses, but if you're able to please complete the poll now, letting us know who you are and how you rate the session about electronic prescribing, and how you feel it can add clinical value in your practice, and the option that it provides to patients over paper scripts. So thanks for completing that poll. Thank you very much to Max and to Sian. Thanks, Max, for such great slides that really make it a lot easier for us to understand electronic prescribing, and for Sian giving us that clinical viewpoint from your perspective. That's really helpful. Nurses always love to hear from other nurses, and it's really important when we're actually hearing from people that are utilising this system in everyday practice. So thank you both. Thanks to everyone for joining us today. We got through quite a lot of the questions. We hope, sorry for those that we weren't able to respond to, but you know now where how to access all the resources and to find out more, and you can contact the Digital Health Agency should you need. So thanks everyone for joining us today. Stay safe. Bye-bye.
Thank you. Bye, everyone.
Thank you.